Okay, hey guys, I'm Tamaria Mitchell, and this is my wound care lab video or check off. So I'm gonna get everything set up. So this will be my wound, and I just had the plastic from the wound covering it as if it was the dressing. And my swabs for my measuring, and then my gloves. So starting the video off, I would perform hand hygiene, provide my patient with privacy, and greet my patient. So I would say, hello, Mr. Banks, how are you today? He would say, good, how are you? I'd say, thanks for asking. So first, before I even get started, I would confirm that this is the correct patient by him doing 2 identificators, which would be his birthday and his name. Then I would look into the computer and the system, confirm that I am doing the wound dressing, so I confirm the orders. And then I would assess him for if he needs any pain medication before we clean his wound, or as well as allergies, like latex allergies or anything with the gloves that I'm using. After that, I would place my supplies on a clean surface, which I already did. So we just say this is my side table. And then I would discuss with the patient, telling him that I'm going to be changing his wound dressing by removing the old one, which we already have on there, and replacing it with a new one, and just explain to him that this is just to keep his wound clean and to promote healing. And I would ask him, will this be okay? He would say yes, and then I would ask him if he has any questions about the process. He would say no, hopefully, and then I would get started. So before I get started, I would raise the bed to my hips. So this is kind of, we'll pretend. And then I'll perform hand hygiene, and I will prepare my supplies, which I already set up. So I have my gloves, I have Q-tip, and the packaging is in has the measurements on it. You can't really see it because of the light, but it has the measurements on it. Okay, so after I prepare my supplies, I will put on a clean pair of gloves. And then I would start by removing the old wound dressing that my patient has on the wound. So it's removed, and we'll just say this area over here is trash. So we'll just throw it over there. And then after removing it, I would note that the wound is by color. We'll do coca. So the color, it is pinkish and reddish. I do not smell anything. There is no odor, and then there's no drainage, so I cannot know if there's any the consistency or the amount because we have no drainage. So after that, I will measure my wound, and we always start from the top down. So I would note that my wound is about 12 by 3. So my wound is 12 by 3, and then I would note if my wound has any eschar, which it does not, or any tunneling, which it does not. So after that, I would throw away my swab. So that's thrown away. And then I will also remove my gloves, because these are dirty now. So we're going to use those. Trash over there. All right, so then I perform hand hygiene, and I will put on my PPE, my appropriate PPE, which would be my mask and my eyewear, in case I was irrigating the wound, anything splashed on my face or anything like that. Then I will open my sterile package, and I will set up my sterile field, which will be this blue sheet. And just try to keep the blue side. And then in this case, the blue side goes on the bottom. So I have my sterile field set up. And then now what I'm going to do is put on my sterile gloves. So I will take it. Open them up. Slide them in a little slide. And because these gloves are reused, my glove is sticking. There you go, I think I got it. It was sticking to the edge. Okay, so we'll put our dominant one on first. Trying to be careful to not touch the inside. Since they've been reused, it's kind of harder to put on just because my hands sweat. Okay, then what we'll do is Put undercover this one. Slide this in. Put this over. Okay, have our sterile gloves. So, throw that out. So next what I do is I just like to set my stuff up first. So what I'll do is I like to take this, and everything in here is sterile so I can touch it. I like to pour some of my solution, sterile solution in there. And I also like to pull up. You pull up 35 to 60 milliliters of sterile solution so you can irrigate your wound. So once I have that already pulled up, well, I'm gonna leave that out because that's my unsterile area. So, but because I don't have like a soft surface, I'm just gonna put this out. But we would pretend that I would put this on the actual table with the sterile field. Okay, so now that I have all my things set up, I would note that I have extra gauze and Q-tip applicators. In this situation, I really don't, so I'll be reusing, but I'll note that I threw it out and used a new one, threw it out, used a new one. Back and forth, back and forth. So, all right. Now that I've drew up my 35 to 60 milliliters of sterile solution, and I've noted that I do have my extra gauze and swabs, I'm going to clean and irrigate the wound, and I would do it from top to bottom. And then I would take gauze. I'm going to put some gauze in my solution so it can be wet and ready for the dressing. So I would take some gauze and I would catch that debris, and I would do it from top to bottom. Just kind of irrigate it, and I would irrigate it till it runs clear. And there's really no debris to catch because okay, and I had no need for this, so I would just throw that away. And I caught my debris. We'll throw that out. And then for each gauze, I would pat my wound dry and then throw the gauze out. I don't want to use up all my gauze, but like I said, I did extra. So pat it dry and throw it away. All right, so after that is done, it's time to pack my wound. So I already have some pre-wet gauze. So what I'll do is I'll keep this as the hand that I'll pack with, since I was already patting and dry kind of thing. So this hand's kind of considered contaminated. So what I'll do is this will be the one that I'll use this hand I'll use the applicator with to guide it and pack the wound. So I'll take this. And what I do is pull this out, all the gauze, stretch it out, and you ball it up, and you start, and you just pack it in, and kind of guide it with the Q-tip, and just pack it in there. Guide it all in. Make sure it's nice and packed in there. There we go. Throw this out. All right, and now I would apply dry gauze on top. Oh. We'll just stretch that. And then I would put my other ADP on top. And then what I would do is secure with tape, and then I would initial it, date it, and put the time. And then after that is done, my dressing is done. So then I would reassess my patient for if he's in any pain or not. He would say no. And then after that, I would remove my gloves, perform hand hygiene. If he was in a hospital setting, we would put the side rails up. After that, I would perform hand hygiene again, and then I would put my bed in low, lock, call light, and reach, and then I would perform hand hygiene again before I leave the room. And that is the wound dressing.